What's up? Welcome to our Long Haulers webinar, Long Haulers, How Post-COVID Syndrome Works. I'm your host, Dr. Taylor Krick. If you're not familiar with me, if you've never, seen my YouTube channel or listened to my podcast, the Autoimmune Doc podcast, I'm Dr. Taylor. So I have a podcast, I have a YouTube channel, I have an Instagram, Autoimmune Doc on Instagram, but I also have a clinic and a practice, and this is what I do for a living. I help people with chronic and complex health conditions. So a lot of autoimmune things, a lot of neurotoxic things like mold, heavy metals, Lyme, tick-borne infections, pandas, again, a lot of gut things, a lot of hormone things, etc. So at first, when COVID was really popular, of course, I wasn't too intrigued, but this long hauler stuff is very, very fascinating because there are a lot of people who were, in good health beforehand, maybe you, if you're listening to this, and now you have, headaches, you have vertigo, you have heart palpitations, you have reflux, you have all these new things. So today, just like it says down here, we're going to go through the mechanisms, the science, some of the research, the lab testing, the important lab tests to get, and the natural solutions to help you solve some of your long COVID or your post-COVID syndrome. This is becoming more of a well-known thing, this kind of inflammatory response that lingers post-COVID that doesn't have really anything to do with the virus still being around. It has more to do with an inflammatory response that triggered. So anyway, let's go into this. First, I want to give, just an outline for, what we're going to cover today. So first thing is just I want to give some credits where credits are due. So I've learned about all these things from mentors, as we all do, especially practitioners, you pick up things along the way. So I learned first about, coagulation and some thrombotic and clotting things, really before COVID, but from Dr. Ann Corson. Dr. Lawrence Afrin is a well-known mast cell researcher, so I haven't learned anything from him personally, but just, a huge in this space. Same with Dr. Kemperaj, another one I didn't put on this list. And then Dr. Theo Herides, I have learned quite a bit from Dr. Theo Herides. Theo Herides, I hope I'm saying it right, he's out of Tufts University. And he's really the first person that connected these dots to me about how a lot of these mast cell mediated symptoms are triggered by COVID, and then the mast cell symptoms are kind of a lot of the lingering effects. So we'll get into that a lot more today. Dr. Karazian is just my mentor in general. So he did publish a seminal paper early on in COVID about how COVID could cross-react and cause autoimmunity. But a lot of the things that I've learned from him just regarding neuroinflammation, really applicable in today's topic. And then especially Dr. Samuel Yannick, big mentor of mine, really taught me a lot about this long COVID stuff, a lot about neurogenic inflammation, a lot about immunology, just a genius when it comes to functional immunology. So first, I want to just give thanks and give credit to them, and especially Dr. Yannick. The second thing, just quickly, is talking about mechanisms. Just the fact that that's what this webinar is about. Most of the people that find my content, they're not looking, they're beyond like, hey, try this B vitamin, hey, try this fish oil. I think it worked well for my friend to regain their smell, or try sniffing this essential oil. They're a lot of times beyond that, and they're looking for what's wrong with me, what's wrong with me, what's wrong with me, because the neurologist isn't telling me, and the primary care is not telling me, and the endocrinologist isn't telling me, and I can't seem to find it on the internet. So that's kind of the person that I'm speaking to today. When you understand the mechanisms, the supplements, the solutions, the lifestyle strategies that you need for your case begin to make a lot more sense. So that's what the whole purpose of today is about, is to explain the mechanisms behind long COVID. How does this happen? What could your potential mechanisms be? The next thing is labs, just touching briefly. We're going to go over, the most important basic labs, and I have an offer of those for you, and then advanced labs as well. So things that you can look at to, again, try to uncover what is your mechanism, what is your pathway for your lingering symptoms. And then we're going to go through natural solutions. The things, again, that I've seen work well for people, the things that I like to use based on these pathways, these mechanisms that I've studied and researched, over the last 2 years since COVID has come around, and really put together this PowerPoint based around, once you understand the mechanisms, then the supplements begin to make a little bit more sense. And so I go through My favorites, I go through their targets. I also go through lifestyle strategies as well. Some non-supplement solutions that, again, I've seen work really well in long COVID people, and otherwise other neurotoxic things. So this is a graphic that we've created, based on the graphics of some others and some things. So I want to go through this briefly right now at the beginning, but this is what this whole webinar is based around. So you get COVID, right? That's part of it. That drives lung inflammation, it drives sinus inflammation, can drive GI inflammation, and that turns on an innate response called a Th2 response. That inflammation in hollow spaces, as Dr. Sam Yannick would say, drives a Th2 response, which decreases your Th1 responses. Th2 goes up, Th2 goes down. That's part of the mechanism of viruses too. It's kind of a self-preserving pathogen evasion mechanism of viruses. It also triggers something called innate lymphoid cells type 2. So this is the adaptive immune system. This is the innate immune system. That drives a copious amount of what's called transforming growth factor beta. We're going to talk about it later in the webinar, but I think that this is the most important lab test that you can get with long COVID. But both of these, this inflammation in the lungs and the sinuses and the gut, will drive mast cell stimulation. This all happens without COVID as well. So this all happens with, if you have candida in the gut, if you have mold in the lungs, if you have chronic sinus infections, chronic staph or strep in the sinuses or in the throat, it's going to drive this Th2 inflammation and this mast cell stimulation. But one of the changes with this is we get a copious amount of reactive oxygen species, and that leads to the formation of what's called neutrophil extracellular traps, and that's one of the mechanisms by which we get microvascular damage. So that's probably the mechanism that most people are the most associated with. And this graphic also does not show everything by any means, because mast cell stimulation is going to lead to something called platelet activating factor, which is also going to lead to thrombotic changes and things like that as well. So this does not connect every single thing, but you have a few major components. You have a lot of reactive oxygen species production with COVID and with long COVID. A lot of driving of TGF-beta is one of the mechanisms behind that. This depletes glutathione. All these reactive oxygen species depletes glutathione. That leads to neuroinflammation. The microvascular damage leads to neuroinflammation. It leads to hypoxia. So this is microvessels. So these are like, the small vessels that get out to your fingers, that get out to your toes, that get out to your ears, that also get into the deepest areas of your brain, tiny little vessels that get damaged, microvascular damage. So that drives neuroinflammation. It drives something called HIF1 alpha. It drives hypoxia, and HIF1 alpha turns on NF-kappa B, and that's neuroinflammation. So some of the major mechanisms are mast cell stimulation, reactive oxygen species production, microvascular damage. All of those can turn on neuroinflammation. Now, when you get neuroinflammation, meaning microglial activation, neuronal excitation, and mast cell stimulation, those act as a vicious cycle. One can trigger the other, and they can go back and forth. So you get mast cells turning on neuroinflammation, turning on microglia, you get microglia turning on mast cells, and it's a vicious cycle. You're off to the races. Now, if that happens in certain areas of the brain, you might get brain fog, you might get anxiety, you might get depression. But if it happens in areas of the brain that control autonomic function, then you get what's called dysautonomia. You get rapid heart rate or heart palpitations. Mast cells line different areas of the heart. They also line different areas of the brain. So a lot of times an overabundance of histamine and overabundance of some of these mast cell mediators leads to the heart palpitations and the heart changes. You get changes in blood pressure, or like POTS, postural orthostatic tachycardia syndrome. You stand up really quickly and your heart rate goes, to 120. Or your blood pressure goes to 80/60, or you get these changes in your autonomic nervous system. Autonomic means basically automatic, meaning you don't have to think about it. You don't typically have to think about your breathing or your heart or your blood pressure or your temperature or even your gut function. We take these things for granted, and those are the things that are getting jacked up in a lot of people with long COVID. So the mast cell is more of a histamine response. So mast cell stimulation, if the mast cells are stimulated in the brain, it's going to be a lot of brain fog and fatigue. It's going to drive a lot of what's called neurogenic inflammation. It can be, again, the heart palpitations. A histamine buildup will lead to achy muscles, achy joints, joint inflammation. Lead to headaches, migraines, certainly. An anti-migraine diet is essentially an antihistamine diet, low histamine diet. Will lead to brain fog, it will lead to anxiety, and it will lead to reflux. So anyway, we're going to get into that a little bit more, I guess. I pretty much just explained it. But understanding these mechanisms for you is going to make the most sense as to, do you need this supplement? Do you need this supplement? Do you need this lifestyle strategy? What do you have to do to put your puzzle together to get rid of your lingering, nagging symptoms? So here's a couple graphics, just from the literature explaining post-COVID. I've kind of already explained some of the mechanisms, but here, this is from post-acute COVID syndrome, PACS, Nature Reviews in Medicine, I think that's what that is. But so it's you get exposed, you get a viral load, your viral load skyrockets, and you get sick, right? But then as you start to get better, your viral load starts coming down. Your viral load that's in your respiratory tract, your viral load in your sinuses stays a little bit longer. But after a few weeks, your PCR test is going to be negative. Your viral load is going to come down. And that's the point of long COVID, is that after no virus, no live attenuating replicating virus is found, not attenuating, just live replicating virus is found, you can still have viral fragments. Viral fragments can persist. But after the virus has been eradicated, you still have these lingering symptoms. So week 4 to 12 weeks and beyond, week 12 is really when we consider it, kind of long COVID. This is kind of subacute or ongoing COVID. But then chronic post-COVID is considered technically 12 weeks. But you have these lingering things. Fatigue, decrease in the quality of your life. That just sucks. You have muscular weakness, joint pain, shortness of breath, cough, need for oxygen, low pulse ox, heart failure type things, anxiety, depression, sleep disturbances, so brain issues. So this is just muscle, mitochondria. These are lung issues, brain, anxiety, depression, sleep, PTSD, brain fog, headaches, heart, palpitations, chest pain, blood vessels, thromboembolism, kidneys, chronic kidney disease, and hair loss, many of the most common things. So here, same study, lung, shortness of breath, decreased exercise capacity, hypoxia are commonly persistent symptoms and signs. You also have changes, fibrotic changes on labs. So that marker that I mentioned, TGF-beta, that's a marker of fibrosis. So if that's elevated, we're concerned about fibrotic changes. Blood, hematologic, thromboembolic events have been noted in less than 5% of people. The duration of the hyperinflammatory state is unknown. Anticoagulants can help. Elevated D-dimer levels can help. That's one of the labs we'll talk about. But people have blood issues with long COVID. Here's heart. Persistent symptoms may include palpitations, shortness of breath, and chest pain. Long term, you may have fibrosis, you may have scarring, you may have arrhythmias, you may have tachycardia, or autonomic dysfunction, neuropsychiatric, fatigue, pain, headaches, dysautonomia, cognitive impairment, brain fog, anxiety, depression, sleep, 30 to 40%. 30 to 40% for anxiety, depression, sleep, that's a lot. And so, yeah, really, really interesting. Endocrine, you could have new diabetes. You could have hypothyroidism that's exacerbated. You could have HPA axis suppression, or people with adrenal issues. Here's GI. It says that it has the potential to alter the gut microbiome, which is going to lead to other things. Here's dermatologic hair loss in 20% of people. And then here's what's going on in kids. So again, Those are the most common symptoms. That's why, you might be here. That's why, you might share this with a friend. That's why so many people are kind of in forums and kind of looking at like long COVID and, you know, just kind of the confusion or the mystery about this. These are some of the symptoms. Here, now we go on some of the mechanisms. So, what all could be happening? Again, I drew the chart, but this all could be happening. So you could have systemic inflammation in your whole body. It's a virus, so you're going to have systemic inflammation. And you can have persistent systemic inflammation. You got a persistent neuroinflammation, inflammation in the brain. You could have mitochondrial dysfunction or changes in energy metabolism. We're going to talk about that and go over some slides of that, but sometimes viruses change your metabolism for viral purposes and it never shifts back. You kind of get stuck in this shift that we'll talk about. You can have dysautonomia. Again, those are the crazier symptoms of the heart rate, breathing rate, temperature swings, blood pressure drops. Dysautonomia POTS are pretty intriguing. You can have microvascular damage. You could have mast cell stimulation or activation. You could have autoimmunity. You could have new autoimmunity. You could have exacerbation of old autoimmunity. You could have worsened autoimmunity, certainly neurological autoimmunity. Exacerbation of any inflammatory process can exacerbate autoimmunity. You could have ongoing barrier systems damage, meaning leaky lung, leaky gut, and you could have reactivation of other pathogens, reactivation of different things. So here's another slide on it. So systemic inflammation. So that could be like if you're just fatigued, if you're achy, if you're gained weight, if you're just lethargic, metabolism. That could be mood disorders, that could be digestive complaints. Neuroinflammation is obviously going to be more just brain-based things. So anxiety, any panic, any depression, fatigue, brain fog, or vertigo. Vertigo is a really, really common one. Or another one along with vertigo is kind of like a depersonalization, derealization type of feeling of like I don't feel completely present. Or another one is just feeling kind of off, like oh I feel like I'm walking on clouds. I feel like I'm not really here. Or then another one is just inability to gate senses, meaning like if the TV's blaring and the lights are flashing and the kids are screaming and your car is moving or whatever it is, those things don't all match up, but if all those senses are trying to come into your brain all at once, and your brain's just like I can't handle all these senses at once, that's neuroinflammation, that's cerebellar, typically. So you can have mitochondrial dysfunction. So viruses, I'll show a slide later where viruses do something called a Warburg shift, where they shift your metabolism to something called glycolysis. Now, glycolysis is important for immune response. It's not a bad thing, but you don't want to stay there. And people get stuck in this what's called Warburg effect, or this glycolytic shift. And so you might have more blood sugar drops. You might have more like fatigue. You might have more weight changes or just like energy change where you need to eat more often or, just, I don't know, changes in blood sugar. That could also be brain fog. That could be anything brain too when we talk about mitochondria. Dysautonomia, again, we talked about that, what those mean. Microvascular damage, that's going to cause hypoxia. So that's lack of oxygen to different tissues, to your kidneys, to your brain, to your liver, to your hands. Microvascular damage is also going to be the menstrual changes. So that's one that a lot of people are very, very familiar with. I personally know just a number of people that have had this as far as a symptom. So yeah, any bleeding, clotting changes is going to be the signs of the microvascular damage. Mast cell stimulation, we're going to get to that a lot, but it's headaches, palpitations. That's one of the main mechanisms of this. If there's one thing that you need to do from a supplement standpoint, it's these mast cells, and I do believe that that's gaining some momentum and traction with like quercetin, luteolin. Those are the two most important ingredients for this. We'll talk about those in a little bit. Autoimmunity, again, you could have existing autoimmunity that gets exacerbated, existing rheumatoid arthritis, existing Hashimoto's or lupus, or anything that gets flared. Or you could have new spike protein antibodies. Spike protein antibodies cross-react with a lot of tissues. most notably neurofilament proteins, which are in the brain, are associated with Alzheimer's. So you can absolutely have neurological autoimmunity from COVID and have that as a lingering side effect. And barrier system damage, and then the viral reactivation. There's studies about this, about reactivated Epstein-Barr virus. See that very commonly in these long COVID cases. Reactivated CMV, HSV, cold sores, HSV becoming a major player in Alzheimer's. Reactivated shingles, some people have experienced. And I did put it on here, but I should have. But it's a lot harder to test for. Reactivated Lyme, reactivated Bartonella, reactivated, a lot of different tick-borne infections. But BCA, I'm sure. But yeah, so a lot of things could be reactivated. So that all could be happening. So now that I've just gone through all the things that could be happening, major head spin, what's happening in you, and what's some of the science behind this again? Where does this come from? Where's this information coming from? Well, here's a paper. Mast cell activation symptoms are prevalent in long COVID. So it's from the International Journal of Infectious Diseases. And yeah, the title kind of says it all. Mast cell activation is a piece of this. Here's another one that says from June of 2021, mast cells are a therapeutic target for COVID-19 and beyond. Here's another one from a different paper that just shows a picture, but it shows that coronavirus stimulates these mast cells, and mast cells release a number of things. So that's why the mast cells are such an important thing, is it's not always a histamine response. It could be a platelet activating factor response, and you're getting microthrombosis. It could be histamine and you're getting runny nose and leaky blood-brain barrier and a lot of brain fog. It could be something like tryptase and you're getting more like leukotriene type responses. Here's your leukotrienes actually. But tryptase, you're getting more like asthma type things. That leaky blood vessels, blood-brain barrier, things like that. Or it could just be straight up inflammation. IL-6, TNF-alpha, IL-1. These are absolutely implicated in coronavirus and the hyperinflammatory response from them. So mast cells really crucial part of this. Here's one about the hyperinflammatory response. This one's about ferritin. Severe cases of COVID are characterized by high ferritin and the cytokine storm, which leads to a high rate of mortality. SARS-CoV-2 may trigger hyperstimulation of the immune system, which leads to a lot of ferritin. They keep talking about ferritin. COVID patients have a high level of ferritin. Again, that's another thing that we'll mention in the labs of testing your ferritin is really important. TGF-beta, ferritin. Some of these things are fairly basic and they're really important. Here's another one that goes into the ferritin with the iron. So what we see are a lot of iron changes too with COVID. A lot of I'm seeing a lot of anemia of chronic inflammation, anemia of chronic infection, which means very high ferritin, hyperferritinemia, or what would appear to be hemochromatosis, but functional anemia, which is going to lead to hypoxia. So it's like that's not good at all. This is a really good paper kind of explaining that combo of like we need iron and oxygen, but we don't want to drive ferritin, drive a Fenton reaction, drive a lot of oxidative stress and things like that. So that could be going on. Here's another one about the mitochondria, the metabolism. And this picture is really good. I like pictures, of course, but it just says that SARS-CoV-2, like many viruses, is likely to hijack the immunometabolic system for its own ends, inducing a Warburg-like shift. In immune cells, this leads to an imbalanced response, where interferon production is decreased. Interferon is a big Th1 cytokine. It's a big virus fighter. You want interferon. But pro-inflammatory cytokines are increased. So we don't want this. And so this Warburg-like shift, it's called, can stay and can linger. And there are things that you can do that we're going to talk about that controls this. It also says that this is tightly controlled by antioxidants. Mitophagy prevents buildup of damaged mitochondria. We're going to talk about all these words in slides a little bit later. So I just want to point out these words so that you know how important they are. Another picture that I'm not going to go into, mitochondria in the crossfire. of SARS-CoV-2 and immunity. So the mitochondria are really important for this. I just did a 3-part series on my podcast, the Autoimmune Doc podcast, about your mitochondria, all about them, how important they are, all that jazz. But you see here again, like here's alterations, here's healthy, here's alterations where you get more glycolysis, you get more reactive oxygen species, you get more hypoxia, you get more inflammation, you get all these bad things that are not good. So, all those are the possible mechanisms. So, one more time, let's look at our graphic, which, we're going to use on social media and things like that. And so, let me go through this again. So, when you get inflammation of these hollow spaces, as again, Dr. Sam Yannick says, inflammation of hollow spaces, and epithelial inflammation, it turns on what's called Th2 inflammation. And the main cytokine for Th2, the main effector cytokine, is interleukin 4. So both Th2 and ILC2s are going to release interleukin 4. Interleukin 4 inhibit or recruits rather mast cells. Interleukin 4 recruits mast cells and stimulates mast cells in a non-IgE dependent manner, which is really, really important. To an allergist, the only thing that mast cells do are allergies. To an immunologist or to a scientist that's not an allergist, they do everything else and many other things. So this is a non-IgE dependent manner, and a lot of times when you measure quantitative immunoglobulins, people's IgE is really quite low, even though they have these mast cell mediated things. So they turn on the mast cells. That's an important kind of first piece. Mast cell stimulation will will release histamine and other factors, which is going to cause leaky gut. It's going to cause leaky blood-brain barrier. They're going to release leukotrienes. They're going to release cytokines. They're going to release enzymes. Over several hundred things get released from mast cells, and they start these cascades. So they will turn on this neuroinflammation. They can release platelet activating factor, which contributes to this microvascular damage over here. These ILC2s and Th2s and just COVID in general is going to drive myeloid-derived suppressor cell activity. A lot of myeloid-derived suppressor cell activity is going to pour out copious amounts of transforming growth factor beta. It's a good thing. It's a tolerogenic cytokine, but in excessive amounts, long COVID patients are the craziest that I've seen lab-wise. I mean, 10,000, 20,000 plus, whereas normal is maybe, let's say, 3, 4, 5,000 or less. But so they'll drive a massive amount of TGF beta. That's a huge producer of reactive oxygen species. Reactive oxygen species damage mitochondria. Reactive oxygen species drive inflammation. Reactive oxygen species will deplete glutathione and will lead to the formation of these neutrophil extracellular traps and damage blood vessels, which causes the microvascular damage, which causes the hypoxia, which causes or fuels the neuroinflammation. If all that's happening in the right places, if you have hair loss and fatigue, then your brain is probably fine. But your mitochondria, your blood vessels, those are some of the mechanisms that you might want to consider, the reactive oxygen species, etc. But once we get to the dysautonomia, that's where a lot of the symptoms are pretty crazy, where it's the vertigo, the heart palpitations, the blood pressure, the POTS type things. Those can really, really get flared. So all those are the important mechanisms for long COVID. Now, how do we fix them? How do we figure out which one is yours? So one thing, where were you at before this? Everybody thinks that COVID is just like the only thing that caused this, and it's absolutely not. I see, one of them says mold. I see so many long COVID people with a mold history. In fact, I very rarely see what I would consider an extreme long COVID patient without a history of mold. I'm not saying that mold is the only thing, but it's usually like a standout thing, like, oh yeah, I know that I had a mold thing a few years ago. But so anyway, your previous symptoms all matter. Oh, and I think where I was going with that too, I had somebody ask me, she said, I was confused. Did mold cause this or did COVID cause this? And I said, my best example is that mold piled up the logs and poured gas on them. If you have a pile of gassy logs in your yard, that's fine, as long as nobody drops a match on them. COVID was the match. So COVID came along and dropped the match. And so the gassy logs would have been fine without the match, and the match would have been fine without the gassy logs. A lot of people skate through COVID pretty easily. But for those of us that don't, it's the combo of things that made you more susceptible to this. There's all kinds of nuances. There's tons of genes that I could explain that make you more susceptible. Your methylation genes, your aldehyde dehydrogenase, just tons of different genetics that could play a role. But here's where you need to look is like what led you to this. So did you have any symptoms beforehand? Did you have any fatigue? Did you have any asthma? As a child, did you have asthma? Do you have allergies? We'll get to that with mast cells. Do you have brain fog? Do you have vertigo? Did you have any symptoms beforehand? Was your gut perfect? Were you completely asymptomatic? Everybody always says, oh, he's so healthy, and then he got COVID, now he's got vertigo. And that person probably wasn't perfectly healthy. Do you have previous environmental exposures? Do you live under a power line? Do you live next to a power plant? Do you live next to exhaust, something with pollution? But mold especially, again, because of the way that molds sensitize mast cells. Mold sensitizes mast cells, so a lot of people in the mast cell activation world, way before COVID, already are very, very savvy and familiar with mold. This is the same world. That's why people like me are versed in well COVID, because we've seen people that are very similar with this neuroinflammatory mast cell activation. Brains on fire, as Dr. Mary Ackerley says. We've seen these people for years. Now it's just COVID is new and there's new research about it. Your previous inflammatory status. So labs, if you had any previous labs, they could predict the bad outcomes. So if your vitamin D was low, you're going to have more hyperinflammatory response from COVID. If your ferritin was high, you're going to have more hyperinflammatory response from COVID. If your C-reactive protein, if your neutrophil to lymphocyte ratio, these are all the markers that are well established. Because what they do is super easy. They take 10,000 people and they say, did you respond good? Did you respond bad? Did you respond medium? And they group them and they look at their labs. And so they can find that the people who respond worse or better as far as their inflammatory response had better labs beforehand. So it's not like some unpredictable, weird, unexplainable thing. It never is. Previous metabolic status. So do you have diabetes? Do you have poor blood sugar? Do you have blood sugar drops? Do you have hypoglycemia? Do you have weight? Obviously, that's a risk factor. Do you have metabolic syndrome, but your metabolic status doesn't always have to do with your weight? A lot of skinny people have broken metabolism. But your previous metabolic status. And your previous mast cell and histamine status. This one's huge. Do you have allergies? Do you take Zyrtec or Zantac or Claritin or Allegra? If the answer is yes, you are more susceptible to having some of these mast cell mediated symptoms, because it's a sign that you have mast cell and histamine stuff beforehand. Zyrtec, Claritin, Allegra, those are H1 blockers, histamine blockers of the sinuses. Zantac and Pepsid are H2 blockers. I believe those are both H2 blockers. So histamine blockers in the gut. The histamine receptors in the brain are, I think, H3 receptors, if I remember correctly. I should know. But there's only 4. But it's either 3 or 4. But there's different receptors in different places. So if you've had histamine issues, or if you've taken proton pump inhibitors, even though Zantac and they're not H2 blockers, I think the mechanism is different there. But those are all ding, ding, ding red flags. Or if you've had, a history of mold exposure again. Or hives, again for mast cell, it's not just sinus. Asthma for sure. Previous autoimmunity. Do you have neurological autoimmunity? Do you have demyelinating antibodies? Do you have cerebellar antibodies? Do you have thyroid antibodies, even if you don't have a neurological disease? Do you already have antibodies? That's not a good sign. Do you have vascular antibodies? Do you have phospholipid antibodies? Have you had vasculitis? these are not good starting points. Do you have thyroid antibodies? Do you have anti-mitochondrial antibodies? Um, that's not, again, not a good starting point. And do you have a previous infection is burden? And again, a lot of you, if you're watching this, you probably don't have any idea of all these things. The point is just that it's very, very nuanced, and that this didn't pop out of nowhere and this, miracle thing just happened to you. It's not unexplainable. It just sucks and it's mysterious, but it's not unexplainable. So do you have Epstein-Barr virus? Have you ever had mono? Did your Epstein-Barr virus reactivate? Do you have cytomegalovirus? Do you get cold sores? Do you have genital herpes? Do you get shingles? Do you have HHV6? Do you have, I guess I already said shingles. Have you had a lot of strep infections? Have you had a lot of sinus infections? Have you had a lot of pneumonia? If you have a lot of Klebsiella or Mycoplasma, you're more likely to get bacterial pneumonia if you get COVID. Do you have Lyme? Do you have Candida? Do you have bacterial overgrowth of the gut? Blah. So anyway, all those things matter. You might not know. You might already know that you've had some of those things, but they all kind of set you up for this. Now let's talk about what do we do, and let's go through some of the studies of this again, just kind of confirming this. I think that most people know that this one's the case. And check out that date. Depending on when you watch this, I just read this the other day. It's February now, but this is just pretty stinking recent. And what they looked at was like, yes, absolutely, there was a crucial link between the inflammatory response and vitamin D. So what do you need to look at for labs for where you're currently at? I don't think the vitamin D is that important, but if it's low, you got to still know. It's more important when you get the infection. But here's what you need to look at, in my opinion: a CBC. So that's a complete blood count. It's a $4 or $5 lab typically. It's very inexpensive. You get one if you've gone to the hospital, and you can look at your neutrophil to lymphocyte ratio. That's one of the things that's come out as being a very good marker for prognosis for COVID. I don't think that it means everything. It's not the end of the world, but you can look at that. And all the other differentials really matter to me. If we see a high amount of monos, it gives me an idea of what's going on. If we see a high amount of basos, we might think more mast cell involvement. If we see a high amount of eos, we might think more allergy or sinus inflammation, or even parasites, or just more eosinophilic inflammation, which is more Th2. So anyway, CBC. A metabolic panel is the next one. So you want to look at your electrolytes, you want to look at your bun creatinine ratio, but you want to look at your EGFR, which is your kidney filtration rate. I see people all the time in their 20s and in their 30s whose kidneys are not filtering very fast or very well. And I will tell them, because this is not a diagnosis, it's just a classification. I'll say, has anybody told you that you are in stage 2 kidney disease? Or sometimes stage 3. And they'll say, no. How would I know? And I say, well, it's right here on your labs. So that's a concern. Liver enzymes, elevated liver enzymes, or transaminases, they're not always in the liver, but those matter as well. So again, these are $4 labs that are really, really important. The next ones are your inflammatory markers, C-reactive protein, and a sedimentation rate. If those are elevated now, then that means you need to decrease inflammation. So they're inflammatory markers to determine your level of persistent inflammation. The next ones are in the blood. So a D-dimer, that's a fibrin degradation dimer, and fibrinogen, which is an enzyme. And so these are coag markers in the blood. Now, I said these are basic labs because some people get into more in-depth coagulation markers, but I think that these are the very basics. If you're having some long COVID symptoms and you want to see, is this a problem for me? Those are the basic labs to look at. I put 2 stars by the TGF-beta. That's transforming growth factor beta. I had somebody that came in recently, and she came from my podcast, and she said, I asked my doctor to run every single lab that you talk about on your podcast. Like, oh, wow. And she had a TGF-beta marker at one point that was over 12,000. And the doctor didn't know what to tell her about that. So it's an indicator of myeloid-derived suppressor cell activity. And it drives a lot of reactive oxygen species, and it's an indicator of fibrosis. And that's all that we need to know. It means that we need a lot of antioxidants. It means we need to be careful of fibrosis. And we need to keep an eye on it. Homocysteine It's another heart attack risk factor marker. It's also a methylation marker. I guess I just said that. And then ferritin and iron. So hyperferritinemia, and looking at the full iron picture, not just hemoglobin, which you're going to get from your CBC, but looking at storage iron and looking at iron saturation and TIBC. Those are all really important. So you need to know all of those things to know your long COVID case, and that's not even going into all the past things of do you have candida, do you have mold, do you have Epstein-Barr. These are the basics. I'll show you some advanced ones in a second. I am offering this panel, so if anybody wants it, this is I did throw vitamin D on there, so that's not on the last slide. But CBC, metabolic panel, C-reactive protein, vitamin D, D-dimer, fibrinogen, homocysteine, TGF beta, sed rate, iron, TIBC, serum iron, and iron saturation, and ferritin for $379. That also includes an interpretation and recommendations appointment. Now you have to work with us in our office. There's not like a link that you can click on and just buy this and look at it yourself. So you have to jump through some hoops as far as being a patient in our office. But then we send you the rec. If you have a LabCorp near you, it's a LabCorp panel. And then we're gonna just on Zoom. We're going to go over just the interpretation and hey, this is where we want this to be. This is where you're at. This is what you can do about that. That's included in this lab panel. Here's some advanced labs that, again, if you're working with me, we can order. If you're working with somebody else, you can definitely look at. But they're all relevant to the long COVID puzzle. So some advanced cytokines, things like interleukin-6, interleukin-1 beta, TNF alpha, complement proteins. I don't do those a lot. They don't yield you much. But if you were at a rheumatologist or somebody like that, they like to get fancy and go ahead and get them. There's other coag markers too. Again, maybe a cardiologist, maybe a rheumatologist might look deeper at some prothrombin time, thrombin antithrombin time. There's some others there too. You could look at a T and B lymphocytes and a natural killer activity. That's actually a great panel to look at to just see a little bit more what your immune system is doing. If your T and B lymphocytes are overactive, or now Cyrex has a new panel that's pretty cool that is a pretty deep mapping of immunology of Th1, Th2, natural killer, different percentages, CD4, CD8s. So you can look deeper in the immune system, certainly. You can look at autoimmune markers. I think that's really relevant. I think that looking at, again, do you have antiphospholipid antibodies? That's a big, 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 big deal with clotting and things like that. And I see them sometimes. Do you have thyroid antibodies? Do you have myelin basic protein antibodies? Maybe not associated with COVID, but still just good to know because when things flare, you don't want that to flare. And so it's good to know or keep your eye on. I don't know that there are any that you particularly need to look at for long COVID. I would look at it, especially like a Cyrex Array 5, which looks at 24 different tissues. I think they just added a couple, so it might be like 25, 26 tissues. But it includes 5 neuro tissues, synapsin, ganglioside, myelin basic protein, cerebellum, and something else, tubulin, but it also would have like ASCA-ANSA antibodies on there and phospholipid antibodies, which would be great for the vascular blood vessels. And I guess then again, viral reactivations, you could look for Epstein-Barr, look for an early antigen would be the reactivating marker. You look for cytomegalovirus, look for Klebsiella, mycoplasma, these chronic infections, Lyme, look for pathogens. You could look at the kynurenine pathway. That I actually didn't mention that with the neuroinflammation. That's one of the mechanisms of this. So within the context of neuroinflammation, there's something called the kynurenine pathway, which is involved in tryptophan metabolism. And anyway, that can be measured. Is your kynurenine pathway being activated? Gives you a more specific answer as far as what you need to do. And the organic acid would also show you mitochondrial markers. Here's the important supplements and their targets. So glutathione and N-acetylcysteine, they quench reactive oxygen species. Glutathione protects the mitochondria and supports Th1 immune system. All throughout every stage of COVID, glutathione is helpful. We'll have people nebulize glutathione directly into their lungs. It's just really, really helpful. I'll show you some of my favorites here in a second. These are just ingredients. Then I'll show you my favorites as far as like brands that I use and actual products that I use. Quercetin, another really important ingredient, probably the second most important. I didn't put these in particular order, but I did start with some of the most important ones. Stabilizes mast cells, and it blocks some spike protein binding, does some other things, but quercetin is gaining a lot of fame, but it's mostly for the mast cell stuff that it does. Bromelain. Bromelain is also another mast cell, but it's an enzyme, and what it does is actually breaks down mitochondrial DNAs in the gut that are very, very inflammatory. Luteolin is another mast cell stabilizer, especially useful in the brain. This one is really, really useful. I would say that glutathione, quercetin, luteolin are the top of the list. Luteolin is probably the top of the list for long COVID if I had to pick one ingredient. Curcumin, another very, very famous one. I had to put just etc. because I'm just doing these off the top of my head of what they do. But curcumin has a lot of different mechanisms. There's over 20 studies showing how effective curcumin is for COVID. But if you have a lot of inflammation, then you need a lot of anti-inflammatories. If you don't have a lot of inflammation, you might take a boatload of curcumin and it not affect your long COVID symptomatology. So that's why understanding these mechanisms lets you know. I'll use some blends with curcumin, but quite frankly, I use curcumin a lot in autoimmune cases. I'm not using it a ton in these long COVID cases as much. Same thing with the resveratrol. Does many things, turns off NF-kappa B, affects AMPK and some metabolism, great for the brain, really great for a lot of things. Curcumin and resveratrol both, use them a lot. Berberine as well. Berberine is great for neuroinflammation. Berberine really has a lot of mechanisms, AMPK, prostaglandins, lots of things. Another one is what's called fish oil, everybody knows about. And high-dose fish oil can be really good for the brain, especially DHA. But then SPMs, which are called specialized pro-resolving mediators, can be really helpful. Again, I'll show a study here in a second that just shows SPMs in COVID. But again, we're trying to decrease neuroinflammation. Those can be really helpful. Another one is these enzymes like nattokinase. I have it sitting right here. Nattokinase. Baluch, wobenzyme. Those can decrease clotting factors and can help with the microvascular things or some of the clotting thrombotic changes. So if you had a high D dimer, if you had a concern of this coagulation cascade that's happening, you might be the person who wants to start taking some natto. Natto is a part of most COVID protocols and long COVID protocols, so it's not an uncommon thing. But once you're 6 months, 12 months down the road, and you still have these symptoms, you're not really thinking like, oh, do I need to follow this COVID protocol? Magnesium. There's lots of mechanisms for magnesium. Magnesium glycinate is the best. B vitamins, B6 especially, but broad spectrum Bs are really helpful. But they support the mitochondria, they support the kynurenine pathway. And even melatonin can be really great. Melatonin is a powerful neurological antioxidant, really great for neuroinflammation, really great for sleep and circadian rhythms, but it can also block that Warburg effect in the mitochondria. A lot of the mechanisms that melatonin has are mitochondrial. So those are a lot of the ingredients. Again, I'll show you some of the examples. Let me show you some of the studies, and then we'll wrap up with some of the lifestyle things, some of the other things you can do besides just pills and supplements. So here's a study that says, from early on in COVID, it says, could glutathione depletion be the Trojan horse of COVID-19 mortality? So basically what they're looking at is, could not enough glutathione be the reason why you die from COVID? I think this is from the same paper, but basically saying SARS, if you have enough glutathione, if you don't have enough glutathione, if your glutathione is depleted, you're going to have unchecked production of SARS, you're going to have end organ damage, you're going to have irreversible damage, and if you have enough glutathione, you're going to recover. So huge fan of glutathione. Here's another one that says the role of glutathione in protecting against the severe inflammatory response triggered by COVID. So important during COVID, also in long COVID as well though. Glutathione supplementation as an adjunctive therapy in COVID. Here's one that says nebulization of glutathione and N-acetylcysteine as an adjuvant therapy for COVID-19 onset. So you could also nebulize glutathione again, kind of at the onset. But if somebody with long COVID is having, some shortness of breath or some breathing issues, or we're concerned about, lung fibrosis, or, they're still hypoxic, then we might want to get glutathione directly into the lungs, and you can nebulize glutathione. We sell one that's made for a nebulizer. Here's the potential role of vitamin B6 in ameliorating COVID. So all B vitamins are important, but B6 has a special role in many different functions, but especially in something called the kynurenine pathway, which is a neuroinflammatory pathway. So that's one of the reasons why B6 is especially helpful for neuroinflammation. And then here's one about those pro-resolving mediators. So pro-resolving mediators. Now what that means is that you want resolution. You want inflammation to resolve. So when you get a virus, you get inflammation. You want that inflammation. Inflammation is good. It's what gets rid of the virus. But you want the inflammation to resolve. So unresolved inflammation is really the problem. So these are specialized pro-resolved mediators, lipoxins, protectins, resolvins, and mucins, and they are like fish oil on steroids, with promoting resolution of inflammation. So what I like using for these things, for these supplements, I like using physician grade blends. So for the mast cells, we sell a ton of, like 6, probably more than this, mast cell stabilizing supplements. So this is one of my favorites. It's called HistaQuell. Here's another one called HistaAid. A lot of them very creatively named. Hist Reset is another one of my favorites. It's on back order right now. HistoX is another one that I use for the leukotriene pathway. D-Hist, so a variety of different blends. For the mitochondria, and physician grade, what that means is that these are reputable supplement companies that you can only get their products through licensed practitioners. So you can't get these off Amazon, you can't get them at GNC, you can't get them at Costco. So these are trustworthy brands that blend these things together. So in the mitochondria, I might use something called ATP 360, and then, or this other one, maybe Mito ATP, or ENRG, or mitochondrial recharge. There are these different blends from different companies that are all fairly good and fairly reputable. Neuroinflammation, I like Neuroprotect that has luteolin. We're starting to use that one from Theoharides. But I use a lot of Neuroflam NT and Brain Reset. Both of those have luteolin in them. Both of those have some quercetin, have some other factors in them. I don't think Brain Reset actually has quercetin in there. But it does have 100 milligrams of luteolin. But here's, Brain Reset. Here's Neuroflam. And so what I do with these also, I can't give this advice over webinar, but if somebody comes in and let's say they have vertigo or like panic and they have long COVID, I will have them take a lot of these. And meaning take it until you feel like that goes away. I can't tell you how many people would get vertigo to go away within 48 hours by doing this kind of ramped up dosage, because we know the things that are in there are effective. And my mentor, Dr. Karazian, I always like to add that he is on Harvard staff Department of Neurology, so it's not like an illegitimate source. But he says how many of these supplements are going to work, we don't know. So you pour it in your hand. When it feels like a lot, sometimes you pour a little more, and that's how many it takes to get these under control. Glutathione, this is my favorite glutathione by far, formulated by Dr. Karazian. So it's called trisomal glutathione because it has N-acetylcysteine, which is the building block for glutathione. It has reduced glutathione, and it also has acetylated glutathione. So it has 3 forms of glutathione. This one's called Tri-Fortify. I don't really know why it's called Tri, because it has the same name in it, but it's only glutathione. So it's just high dose, straight up, really high quality, liposomal or liposomal glutathione. Here's another one called G-Cell that has just a lot of the factors, a lot of cofactors for glutathione recycling. A lot of B vitamins, a lot of methylation support, molybdenum, um, yeah, just a pretty high dose methylation, some green coffee, green tea extract, cordyceps, great for glutathione recycling. And then the pro-resolving mediators is another one. So those are the supplements that I like and that I use. Now, if somebody comes in and let's say they have um, mast cell mediated neuroinflammation. So they have, let's say, they've had a history of allergies, they've had a history of mold exposure, and they're starting to get this neuroinflammation. It's kind of like anxiety and panic. I'm going to use like a mast cell stabilizer and a neuro anti-inflammatory at high doses, most likely. If somebody comes in and they just had a menstrual bleed for 2 weeks, and then now they have a D dimer of elevated, let's say it's, I don't know, 60, or they ever did, and that we're suspecting more blood flow issues, then I'm going to use different things. I might use some enzymes, I might use some anti-inflammatories. If somebody comes in with blood sugar drops and they get very fatigued and they get very foggy in their brain and they all of a sudden have motion sickness and vertigo, I might use more of a neuroflam and a crap, what did I even say now? More of a neuroflam and a mast cell stabilizer, but we're more trying to call them neuroinflammation. Oh, and a mitochondrial support was what I was going to say. Or again, if somebody comes in with profound fatigue, I'm wanting to know, okay, what's going to wear you out more? Doing physical exercise or doing mental exercise? Is your profound fatigue coming from your brain or is your profound fatigue coming from your body? If it's coming from your body, then I'm going to want to see some of your inflammatory markers. I'm also going to want to see your iron, your ferritin, and make sure that you're not hypoxic. I'm going to want to make sure you're getting oxygen, and I'm going to make sure that we're supporting the mitochondria so that you're not as fatigued out in your periphery, while we're also neutralizing antioxidants or neutralizing oxidants rather, and maybe using some inflammatory things. So that's kind of how we piece these things together. Now, supplements are one thing, and I think they're an important piece, and I think that that's why a lot of people are on this podcast probably, or this webinar rather. The people that I have seen with long COVID have a crazy amount of supplements. You guys are really knowledgeable, and you have a lot of supplements. I mean, a lot of people that I've seen, they've got like their whole apothecary at home of all the right things, but they're shooting a bear with a BB gun and they're taking 8 things at once looking for that magic bullet, when the reality is they might just need more dosage of one thing. A lot of times you're on the right track with some of these things. But that's one thing to do. So let's say that here you are, you can't get well, you do supplements, it's going to help. You add some of these other lifestyle factors, it's going to help even more. So the next one is vagus nerve stimulation. So a lot of things are affected in the brain, and vagal motor outflow can be affected through limbic area disruption, through all kinds of neuroinflammation. But the vagus nerve is the main nerve of the autonomic nervous system. It's the main nerve of the gut-brain connection. So when you stimulate the vagus nerve, this is a TENS device. So we sell these TENS devices. They're $60. These ear clips are $15, I want to say. And you clip it on your ear, and you stimulate the vagus nerve, and it helps restore autonomic balance. There's a myriad of studies about this. I've got videos about this. There's a study that shows that it can decrease limbic brain activity on an fMRI. So they hook these people up to transcutaneous vagus nerve stimulation, put them in an fMRI, and it calmed down activity in the limbic areas of their brain. Can decrease sympathetic activation because it's the main nerve of the parasympathetics. And I should have mentioned too that with a lot of long COVID people, they've got a lot of imbalance in their stress, their fight or flight, and their rest and digest. So sometimes they, like, one little stressor can trigger anxiety or panic, and they don't have the brake pedals to shut it off. So I do also use a lot of adaptogenic herbs to just support that stress chemistry in that balance. But adaptogenic herbs combined with vagus nerve stimulation can be really, really helpful. And it can be systemically anti-inflammatory through something called the cholinergic anti-inflammatory pathway. So again, there are studies showing that this actual application helps, but there's a myriad of studies about vagus nerve. And here's one just not about stimulation, but about autonomic balance in COVID. So your autonomic balance, that balance between gas pedal of life, fight or flight, and brake pedal of life, rest or digest, that balance, says in this study, determines the severity of your COVID-19 course. So it says There's the highly expressed cytokines, right? The cytokine storm. And it says the vagally driven cholinergic anti-inflammatory pathway stops the action of NF-kappa B, which is that's what turns on the cytokine storm. So having enough vagal motor outflow stops the production of NF-kappa B and the production of these cytokines. Thus, well-balanced cytokine release depends on adequate vagal signaling. So really, really cool application that we use. Yeah. Here's another one, fasting and or ketogenic diet. So if the mitochondria have been hijacked, then you can take metabolic control back. And that's really, really important for somebody with long COVID or somebody that's just lost control of their metabolism. We see people with broken metabolism all the time, even if they're thin, even if they're a CrossFitter, it does not matter at all. And you can take control of that back. If somebody's flipped the light switch off on your metabolism, you could switch that back. And prolonged fasting and keto diets are the best way to do that, to change the way that your mitochondria are using fuel. So prolonged fasting, both intermittent and extended fasting, helps the immune system, helps shift metabolism, which is fuel usage for energy, helps stimulate autophagy. Autophagy is like Pac-Man eating up bad cells in your body, bad immune cells, senescent cells, meaning useless old cells that your body doesn't want anymore, and getting rid of those. This is like dusting your house. If you don't dust regularly, it's going to get really dirty and really junky, and that's the same thing with your body on a cellular level. Fasting helps clean that out. Mitophagy is the exact same concept, but mitophagy is the eating up of the mitochondria. Phage means eating, and it's eating up the mitochondria. And so mitophagy will be inhibited by reactive oxygen species, by this inflammation. And so we want to stimulate mitophagy and autophagy. Prolonged fasting will also induce ketosis, and ketones are a preferred fuel source. So a ketogenic diet is really, really helpful in these cases. And what I mean by a ketogenic diet, I mean gluten-free, I mean dairy-free. So not like, hey, I'm going to eat all the ice cream in the world and now I'm keto, or if it's low sugar, whatever. But keto is sometimes highly highly, it needs to be anti-inflammatory keto, paleo-ish keto. But ketones, if you can get your ketones measurable on a blood meter up above 1.0, it's going to be very, 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 very helpful for your brain and your blood vessels. Ketogenic diets are anti-inflammatory. They scavenge radical oxygen species, reactive oxygen species. They increase mitochondrial glutathione levels. They balance the GABA to glutamate ratio, which is very, 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 very important in some of these anxiety and panic cases. So keto combined with vagus nerve stimulation can really calm down some of this hyper excitation in the brain, this neuronal excitation. And it decreases kynurenine metabolism, which does the same thing. And it is neuro anti-inflammatory. So very, very important, some of those mechanisms. So again, if you do one of those things, awesome. If you take a couple supplements, awesome. Make sure you're taking them at high enough doses, my only recommendation. Don't be reckless, of course. If you add vagus nerve stimulation, that helps. If you add a ketogenic diet and you get your ketones up, that helps a lot. And so a combo of these strategies can be really, really, really helpful to get you out of a deep or a long COVID case. If your haul is getting too long, if you're just a short hauler, you might just be like, okay, I'm going to try, Histoquel, or I'm going to try glutathione. As your haul gets longer, your motivation gets higher. So let's recap. So we know many of the mechanisms of long COVID. We don't know them all. They're still coming out. The science is still coming out, but we know a lot of the mechanisms. Your previous health history determines your outcomes, though. So that's really important, too. This is not a mystery. But many people, again, were previously very healthy, were previously doing everything that they thought was right, or at least everything that was at least adequate to not have crazy symptoms. And then all of a sudden they got sick and now they have these crazy lingering symptoms. So I am very empathetic to this case, these cases. Depending on your history and your symptoms, Your mechanisms may be different than the person sitting next to you, but generally these 5 mechanisms are involved. One, mast cell stimulation and activation. That's kind of the big one that sets off this whole cascade. Those mast cells are really, 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 really important. And that mast cell activation could be a vicious cycle that just continues and continues and continues. So it needs to be shut off. Number 2 is excessive reactive oxygen species generation, or along those lines, fibrosis. So that's going to fuel neuroinflammation. That's going to fuel microvascular damage. Number 4. So all these things kind of interconnect. Number 3 is inflammation, which again, inflammation is going to fuel microvascular damage. You get oxidation of cholesterol. All these things that inflammation drives heart attack and heart disease and atherosclerosis and clotting and strokes and things like that. So they're all driving each other. But you can have systemic inflammation. So again, your body is tired, your liver is inflamed, your kidneys are inflamed, your gut is inflamed, or you could have neurological inflammation, or you could have both and one drives the other. Microvascular damage is going to be more of the clotting, the menstrual changes, the thromboses, and it's going to lead to hypoxia, as evidenced on some labs, and harder to see on symptoms. But like if your pulse saturation, your oxygen saturation rather, ever got low, that's a sign that we might have some hypoxia issues. We want to make sure that you're not anemic. We want to make sure that you're getting oxygen, appropriate amounts of oxygen to those distal areas of your brain and of your fingers and of your nose and toes and things like that. And then lastly, mitochondrial and metabolic dysfunction. All these things cause that, and that is the root cause of all disease. So sometimes we have to nurse your mitochondria back to health. I just finished a 3-part podcast series all about mitochondria on the Autoimmune Doc podcast, so if you want to know more about that. But when you begin to understand these mechanisms, you begin hopefully to understand how you can use these solutions that I'm talking about to solve your puzzle, or the solutions that are common out there. I have people say, oh, I saw on Facebook that my friend said you should take B vitamins for hair loss because it helped her hair loss with long COVID. And I try it. But again, for most people that are here, my assumption is that your long haul's getting long enough that you want to know a little bit more about what's going on, or why you have these recurrent symptoms, or this chronic fatigue, or these new onset symptoms that weren't there before. So I do have a lot of other videos and a lot of other podcasts, talking about some of these mechanisms. So some of these things I just skimmed. Please follow us on Instagram. Please download my podcast. Please subscribe to my YouTube channel. And most of all, though, please share this with somebody. That is why I'm passionate about sharing this info. I have a clinic. I see people in these cases. That's what I do for a living. So if you're interested in that, we do free 15-minute phone consults with people. We have new patient appointments. Certainly, we have the lab that's available that we talked about. I'd love to help you with your case, but I do this for education in my free time, if you can call it that. My wife might argue that it's not free, but my practice is pretty busy. I'm not like looking for new patients, but I think that I love new patients. Don't get me wrong, but there's not enough information out there about this. There's not enough information about these mechanisms and what you can do. And yeah, you can go and Google certain supplements, or you can try different things that your friend read on Facebook. But to have a knowledgeable explanation of, no, this leads to this, leads to this, please share this, please share this, please share this. Nothing would mean more to us than you sharing this, because a lot of people are experiencing this. But here's some other videos. How to stimulate your vagus nerve with a TENS device. That's the most popular video I've ever done. I don't know how many downloads it's at to, like over 30,000. But we send TENS devices all over the country, so you can purchase one of those through us. But it explains, again, that process. There's a video about the research behind ketogenic diets and fasting, how they support the neurons, the studies behind that. There's another one about MS and the kynurenine pathway, and how keto diets can help that. This one's really, really great for you long haulers. It's limbic system disruption and cell danger response. That one's really, really good. That's what happens is your cells sense danger from COVID, or from mold, or from Lyme, or from PTSD, or from not knowing where your next meal is coming from, or all these different traumatic things throughout our life. The cells sense danger and they communicate with other danger. The mitochondria do it all. And that happens a lot in the limbic areas. So in the limbic areas where you've associated a memory to every, a feeling rather, a sense to every memory, it's kind of connected. I always say, what if you smelled a rose while you touched a hot stove? Your body would always kind of be associating that smell with like danger, fear all the time. And that's what can happen with COVID and with other things like this. Your cells remember that danger, and the turtles don't want to come out of their turtle shell because they're scared. And mast cells and autoimmunity, just about the mast cells, what they're implicated in. They're implicated in MS and RA, certainly allergic diseases. But that's on the Autoimmune Doc podcast, which can be found anywhere podcasts can be found. Thank you so much for staying tuned. Hopefully that was helpful. Leave us a comment, leave us a rating, leave us a review, any of those things. I always say that in my podcast, I guess. But more than anything, share this with a friend, please. And hope it was helpful. Let us know.